I'm Rosie. I'm going to be teaching you how to insert and remove an NG tube. So the first thing you want to make sure is that you have the order and that you provide privacy for the patient. So either draw any curtains, close the door, whatever needs to be done. You want to identify yourself to the patient and double check that you have the right patient. So as you walk in, hand hygiene. Hi, Mr. Smith, I'm Rosie. I'm going to be your nurse for today. Can you tell me your full name and date of birth, please? Okay, I'm going to just check your wristband here. Okay. So as you know, the doctor has ordered for me to place an NG tube. So the tube will go in through your nose and down into your tummy so we can hopefully give you some relief of those tummy issues you've been having. So you want to lift the bed to a working position and then sit them up to a high Fowler's. You want to make sure you have your supplies gathered. So I have an emesis basin in case you need to throw up and some tissues in case they need them as well. You want to protect the patient from any vomit or any secretions that might spill on them. You also want to make sure that you have a stomach tube. So this is what's going to be the NG tube. You want to make sure that your suction is working. You will need it at a low intermittent rate, but don't connect it just yet until we're in like we're supposed to. So we will need gloves and we will need some tape or a marker and a marker and some lubricant. So we'll get out of our stomach tube. We're going to assess the patient before inserting the tube. So we want to take a look with our pen light. Take a look in each nair, have them tilt their head back. I'm going to remove this pillow from behind your neck, from behind your head. Assess their nairs. So you want to check for any obstructions and check the mouth. Want to double check that it's all clear. So now we measure how far we're going to go in. So you want to start from the tip of the patient's nose, back to around their ears, and then down to the xiphoid process. And this is where you could either mark it with a marker or use a piece of tape to tell you when to stop. So I'm going to use this piece of tape. It'll tell me when to stop. We're going to go ahead and use lubricant for the first 2 to 4 inches of the tube. And lubricate the tip. And we want to instruct the patient to tilt their head back and tilt their head back. And then once you meet resistance at their throat, instruct them to tilt their head forward. So take a deep breath in, and in it goes. Okay, we're at the pharynx. Tilt your head forward, and now we go in, all the way in until you can reach where you marked. So you go in, and now we're going to gather our tape. We want to secure it in place. Remember to check for any latex allergies. You might have to change the type of tape that you're using for your patient. And so now we connect it to suction. Again, at a low intermittent rate. low intermittent rate. And we do not use the NG tube for anything else. We will not insert anything until it has been confirmed with an x-ray that it is in the right place. And once we're done, we document how the patient tolerated the procedure, what type of NG tube we use. So this is a 12 French. We will document which nair we use, so we use the right nair. Any secretions that we can already see, so we would check the canister for secretions, the amount, the color, and make sure everything is documented. Before we step away, we're going to give them their call light, lower the bed all the way down, put their head back as comfortable as they'd like, give them their pillow back, clear everything, and that's it. So now I'm going to show you how to remove the NG tube. So first and foremost, we have to make sure we have the order, and then make sure we have the right patient. So again, hi Mr. Smith, my name is Rosie, how are you? I am going to finally remove that NG tube. We have the order, yes. May I just check your wristband real quick? Perfect. Okay, what's your date of birth? Alrighty. So we want to make sure, again, that we have the towel placed, that we have an emesis basin in case they throw up, tissues, and I brought a syringe. So first we're going to turn off the suction, disconnect the tube from the suction. We're going to clear the tube. So we're going to add about 15 milliliters of air or about 10 milliliters of water just to flush the tube down. Okay, clear the tube. Bring the emesis basin closer to you. Okay, are you ready? Let's remove the tape. Okay, tilt your head forward a little bit, and when I tell you, you're gonna take a deep breath in, and that's when I'm gonna take it out, okay? Ready, 1, 2, 3, take a deep breath in. Perfect. So we're going to assess that the tube is intact. Assess that the tube is intact and discard. Check with the patient, do they need any sort of care for their nairs? Do they feel okay? And then we go ahead and clean up. So again, we document once we're done. Make sure we document that the tube was intact and how the patient tolerated the NG tube removal. We want to bring the bed down. Give them their call light. You can call me if you need anything. Back to a comfortable position. Give them their pillow back. Clean up, and we're done.